My name is Hassan Mahmoud Al-Hemer. I do reside in Kakuma refugee camp since 2006. I came here, then I continued with my studies. So after that, I'm done with my studies. I went to medical school. After medical school, thereafter, I came back to community where I started serving the community. But with all those serving the community in the hospital alone wasn't enough. So I've seen a lot of gap in the community, such as there is a lot of diseases outbreak in the community of which people they're not aware of. So thereafter, I've seen that kind of gap. Then I initiated this kind of CBO with other team in order to at least uplift my community. That is refugee communities as well as the host community. So that's when I started this community vitality solutions in the year 2020. Thereafter, I do train the students inside of medical field, that is the first aid as well as clinical medicine. So the class is divided into two sections, into two groups. The number of students that are currently in class are now this cohort 6, there are 183. So out of which I divide them into two groups, that is Group A and Group B. So Group A, they come to class 3 days in a week. Then Group B comes to class 3 days in a week. Then we have 1 day that we're left for having some meetings with the staffs and other arrangements that we do have. So the learning divided into two sections, that is practical part of it, as well as theory part of it. So theory, it is 10 months, and then practical 2 months. So for the practical sessions, we do send the students to the Kenya Red Cross hospitals, as well as other clinics here in Kakuma. They do go and take some practical skills. So in class, we do also have some kind of interaction of which with the students, so that we can learn, let's say, question and answer, like discussion method. We also use like lecture methods, of which we do interact with the students very well. So those slow learners, we can at least give them time to uplift themselves. And those who are fast learners, also we can give them extra work to do, so that we can able to equalize them in class as well. So that is how we do interact with the students in class, as well as the kind of teaching that we mostly use in class.
أنا الطالبة إيناس ضيف الله هاشم، بقرأ في ميديكال CVS دكتور حسن. فبدأت من السنة اللي مضت، والحمد لله بالفترة السابقة لحد حاليا عرفت حاجات كثيرة، وتعرفت على أنواع الديسيز والمانجمنت وكيف أعمل له دايجنوستيس. فبالتالي والحمد لله عرفت إنه أقدر كيف أعالج المرضى إن شاء الله. فبجد الكورس قدم لي حاجات كثيرة، فكان كمية من الأدوية عندي ما بقدر استخدمها، ما بعرف هو نوع من الديسيز اللي هو بيتطلب لهذا المرض.
I have got many things. Even myself have already got change of myself, because what I was not having when I got in the class, I'm now trying to also improve myself. And there are many things also I got it in the community that we were not having before. But since when I came and I learned it in the class, I also went and implemented in the community, because there are things like the agent in our communities. The way people are just putting these latrines, they were somehow in the way that can even make contamination to the people in the community. So I went and I also tell them on the side effects of such a latrine should be washed and should all do these things. So these are the things that I got it from the class, and I'm now improving. And actually where I'm living, the environment is okay. And when there's something small, people just come to me and talk to me, what should we do now?
So that is the little achievement that I've gotten in this kind of training that I've trained. So students are many. So far we achieved 332 students who have been graduated from this course, that is general medicine and laboratory services. And they are really doing well, those who are working in the hospitals and those who are working in other areas like community health workers. So they are really doing well. So it is kind of achievement that I've achieved. And with this training as well, around 3 students who applied for Canadian scholarship. So they have been taken to Canada to work as international staffs in the same field, that is medical field, of which they took the courses here and they're now working in abroad 2 of them, they went to America, United States of America, and they're really doing well as well there. So this is what brings me the joy of which to continue with this kind of trainings to help my fellow refugees as well as the host community.